it's been almost 2 weeks since my surgery for collecting my eggs. And so last week I was told by the hospital that I had 11 actual fertilized eggs, which is great news. And I think that's where we had left off. So in the time being, I had spoken to my nurse, and obviously she had confirmed with me that yes, 11 eggs were fertilized. And so from that point on, we were just going to see, how they were going to grow and mature. And on the following week, I was confirmed that 7 actually have been fertilized and had grew. So from the 11, I had 7 actual eggs grow into embryos, which have been now frozen. And just this week, I had a Zoom meeting with the doctor, who was actually able to tell me in detail. So one of the days within the 5 days, I had 5 eggs that were actually able to mature and grow into embryos. And then the next day I was able to get 2 other eggs that grew and matured. So yes, in total 7 eggs have been put aside. And now the conversation with the doctor is that a plan will be put together. I will take some medication to help with my hormones. So once I get my next cycle come through, I will start taking some medication to help my body actually ovulate. So I think that's the way that we are going to be going. Taking medication to help my body ovulate. And then from there, we'll also start doing the egg transfer. And that's basically it. I will start getting confirmation with my nurse. Once I have my cycle, I will call her up and we'll go through the plan, and then we'll organize the hospitalization for myself to go in and do another day surgery. Okay, and I just want to reflect back on some of the symptoms and things that are meant to happen after your procedure. So after procedure, the nurses and doctors had mentioned to me that you should get your periods or a bleed within 5 to 7 days, and which I did. So I got that within 5 days. I was able to have a bleed for almost like a normal period. And the only thing that I mentioned to the doctor as well during our meeting was some of the symptoms that I was feeling during that. And she did say that was quite normal for us women to experience that after the procedure, which was nausea still. So I think a few days after having my periods, I feel quite nauseous and dizzy. And I was able to just take it easy a bit for a couple of hours. It was actually uncomfortable feeling as well. I never actually have felt like that. So that could have been something from the medication the doctor has said. And I did notice I had a couple of blood clots as well, and which the doctor reminded me, yes, of course, that could be a normal thing as well. So I think you have to look at yourself when you are doing your IVF as well, and you have your surgery, that to make sure that if you do think something is unusual, just to check with your nurses or your doctors, and if you feel that something is not quite, to go to your doctor as well, and just to check that out with them. And I think on the other hand as well, mentally, I have felt it quite strange. Just going through the whole motion of it, I think I've felt the whole procedure of taking the eggs out of my body, and they've been stored away, I suppose for future use. I have felt psychologically that something's been taken away from me and I don't know how to handle it at the moment, which is something I haven't really mentioned to my doctor, and it's just a feeling that kind of comes and goes at the moment. So I'm just going to monitor that feeling and see how I go within the next couple of weeks, and hopefully it slowly goes away, and that I'm trying to make myself understand what's actually happened and that it is a good thing. This is a emotion that we're going through, and once I get my cycle, get the plan going, and we'll be able to get the nurses being able to get all the embryo and do the day surgery and get the whole treatment done, and hopefully after that, you know, everything works well and that we're able to have a healthy growing baby. So yes, I hope to be able to keep talking about the procedure, and that this is a successful story.